Welcome to the AirLink You Can, Two Can video series. Take one.
Dr. Meyer,
Here's the toucan.
Jason, I didn't say toucan, I said you can.
Oh.
Hi, I'm Dr. Peter Meyer, Medical Director for AirLink at Regional West Medical Center.
And I'm Tracy Meyer, Chief Flight Nurse at AirLink, and we'd like to talk to you today about the proper application of a Sager traction splint.
This is a You Can, Two Can presentation.
Pull!
Now the indications for the Sager splint are a unilateral or bilateral femur fracture and only an isolated femur fracture.
Initially, you're going to start out by removing your patient's socks and shoes and doing a baseline CMS assessment.
We're going to hold inline traction, manual traction, and again, check for pulses, capillary refill, distal sensory.
Next, place the Sager traction splint to the uninjured leg for proper measurement. Extend the traction splint approximately 4 inches beyond the heel.
Now, some of the contraindications of the Sager splint are a pelvic or hip fracture because of the counter traction that the Sager splint is going to apply to the groin and pelvis to provide stabilization.
Next, place the traction splint next to the affected extremity. Caution to avoid the external genitalia. The ischial strap is secured first and snugly.
In the indication for a bilateral femur fracture, you can apply it to both femurs at the same time.
Next, the ankle hitch is applied. The ankle hitch must fit snugly around the ankle. It's okay to place additional padding to make that ankle hitch fit tightly. Once your ankle hitch is on the ankle, you must then attach the ankle hitch to the Sager splint itself and apply the appropriate amount of traction. Traction is going to be about 10% of the patient's body weight, not to exceed 22 to 25 pounds. You'll see the patients have a relief in pain with administration of the traction.
Once traction's been applied, maintain manual stabilization and reassess for pulses, capillary refill, distal sensory.
Next, you can start by applying your external straps. Start with your longest strap first, around the thigh area. Next, move down to the knee area. And then finally, your last strap is going to go around the ankle. Each time you put the straps on, you're going to encompass both the extremity as well as the post of the Sager splint.
At this time, we can finally release manual traction, but once all the traction and straps have been applied, do a final reassessment of capillary refill, distal sensory, and peripheral pulses.
Finally, to prepare your patient for transport, you must next secure them to the backboard to decrease movement of the splint during transport.
This has been a You Can presentation from AirLink at Regional West on the proper application of a Sager traction splint.
Thank you.